Good afternoon and welcome to the second webinar, pre-conference webinar of Health Coaching Switzerland. So today we are talking about managing stress in healthcare, and I will introduce myself. I am a professional certified coach, ICF. I am an health and medical coach. I am also a caregiver coach. Family caregiver coach, in fact. I'm a menopause support coach. I am an affiliate trainer and mentor for Health and Medical Coaching Institute, who does medical health and medical coaching training programs. I do corporate workshops and one-to-one coaching, and I am a medical conference speaker. So let's dive into our agenda. We will talk about stress and body responses, compassion fatigue and moral injury, self-care, emotional agility, and I will provide some coaching tools. Which are the goals of today's webinar? Recognize early signs of burnout and emotional overload. Learn strategies to build emotional agility for yourself and your team. And explore also how caring for your own well-being strengthens your ability to activate and empower patients. So let's dive into health and medical coaching, and let's explore what does it mean. First of all, health and medical coaching supports people living with health or medical conditions. This includes those going through a diagnostic process, living with chronic illnesses, acute illnesses, coping with stress-related illnesses, recovering from injuries, and or living with disabilities. It empowers people to become fully aware of their unique needs, challenges, and goals. It develops emotional, cognitive, and mental coping strategies, builds communication and relationship skills, and increases emotional agility and resilience. It is a person-centered intervention based on theories of behavior change, combining self-discovery, active learning, education, and self-monitoring. So, of course, it is coaching, but it is a very specific coaching in the domain of health. And here we are talking about health and medical coaching in healthcare field. And this means supporting healthcare professionals through one-to-one sessions, workshops, or seminars. And more often, it is about integrating a coaching approach into clinical interactions with patients to increase patient engagement and adherence. So normally, when we are talking about the healthcare field, it is about focusing on effective communication skills, shifting from burnout and compassion fatigue to resilience and self-care, and it is about medical leadership. So let's talk about recognizing stress. So we know that physical and physiological reaction to a perceived threat. So this is, in fact, what is a stress? So it is a reaction to a perceived threat. It's an alarm. It activates the sympathetic nervous system. But I think that the most important thing is that each person responds differently to stressor. So what can sound as an alarm, as a perceived threat for me, is not for you. And the same body response to internal and external stress triggers. This means that if the trigger is internal or external, it has the same body response. So it is a stressor. In the healthcare field, an internal trigger could be an emotional involvement with a patient. And an external trigger, for instance, could be lack of time or an administrative burden. But most of all, there are invisible challenges for ACPs. Compassion fatigue. I don't know, maybe you don't know about the definition, about what does it mean. Compassion fatigue is defined as a combination of physical, emotional, and spiritual depletion associated with caring for patients in significant emotional pain and physical distress. This is a burnout that comes to healthcare practitioners. And there is also moral injury. This comes from USA. This is quite new, but it refers to the psychological, emotional, or spiritual distress that arises when healthcare practitioners are forced to act or are can't act in ways that go against their moral or ethical values. It is not a mental illness, but it can contribute to serious conditions. What is important here is that moral injury can come from making decisions that go against what we would like to do. Like, for instance, triage in emergency situations, that the medical doctor needs to decide what to do in an emergency. Or they perceive that a behavior is unfair. Or maybe they feel, medical practitioners or healthcare professionals, they feel betrayed from the institution, from the hospital where they are working. Or maybe they are unable to provide their service to the patients because of a lack of resources or protocols. But this is something that is coming a lot now. So let's dive into stress. There are 4 body responses to stress. There are physical responses, and probably you have experienced already these physical responses: blood pressure, heart rate, body temperature, problems with breathing, headaches. Emotional responses like normally fear, anxiety, anger, shame, sadness. Cognitive responses, confusion, a distorted perception of the reality, impaired judgment, memory problems, but also there are some behavioral response like loss of interest, aggression, a lot of crying, nervousness, and this feeling of being alone, feeling alone. So the first step as coaches, but also the first step that a healthcare professional can do is an invitation to listen. As coaches, we know about active listening, but here the first step is really to listen to ourselves. Listen carefully what is happening inside us. To feel what is happening. How do we feel in front of a specific situation? To name what is the problem, what is the feeling, what do we know, what is happening? And of course, to get the more information regarding what is happening to us. This is always the first step. In a coaching session, we could ask the client, we could invite the client to talk about this, but also for a healthcare professional, it's really an invitation to pause and to listen carefully, because the body is always sending some messages. And of course, we need to talk about self-care. So to fasten our seatbelt, this is very important. This is the only way to deal with stress, to manage our stress. So the first thing, of course, is to ask ourselves and to ask also to our client, what does self-care means to you? Because self-care is different depending on who you are, what you do, what are your experiences. So the first thing is the definition of self-care, which is very subjective. And here are some definitions I provide. It refers to the deliberate actions a person takes to maintain and improve their physical, mental, and emotional well-being. So as you can see, it's about the person, the whole person, the physical, the mental, and emotional well-being. It includes, of course, everyday habits and choices, because self-care needs to be practiced daily. And it is not just about the occasional threats or relaxations. It includes basic, consistent behaviors that help you stay healthy and function well in daily life. So we can improve our self-care, we can change our self-care. This is something we can learn. And of course, it changes through the circle of life, the cycles of our life. Why self-care is so important and why does it relate to good leadership? This is another point. Because of course, self-care is not just about us, but it is about, of course, who is around us. First thing, you can't lead well when depleted. So self-care restores energy needed for effective leadership. It improves emotional intelligence. It helps leaders stay calm, self-aware, and empathic. It sets a positive example. It shows to others that balance and well-being matter, reducing burnout culture. So, of course, the more you're balanced, the more you will provide balance around you, because you will be an example. And it enhances decision-making. Rested leaders think more clearly and strategically. And it builds trust, because calm, regulated leaders create safety and stability in teams. So this is about self-care and the relation to others and the team. Another important fact is that self-care relates also to patience, because self-care helps maintain focus and empathy to the patients. It engages patients and builds confidence in self-care, because if we know how to take care of ourselves, we can also give information to patients and to the person around us, and to start self-care and to build confidence about what does it mean. Self-care also brings a better communication, because of course, if a healthcare practitioner is centered, he will communicate better. It improves treatment adherence, and there will be stronger health outcomes. So a centered, balanced medical doctor, an healthcare personnel, and healthcare personals, the more they take care of themselves, the more they are centered and focused and balanced, the more they will activate their patients. So what does it bring? It brings more resilience, more empathy, a better health, a positive leadership, more energy, more balance, and at the end, a better therapeutic alliance. Another main thing is talking about emotions. Because in the healthcare field, emotions are everywhere. There are energy emotions. We can't talk about coaching without touching emotions. We know as coaches that emotions are in the space of coaching, but emotions are very present also in the healthcare field. They can't be avoided, but we can only move through them, because avoidance increases stress and awareness instead creates clarity. So it's about bringing emotions into the coaching space, into the health and medical coaching space. And it's also about bringing emotions into the healthcare field, in the relation you create as healthcare personals with your patients, with your team, with caregivers, with everybody. And of course, emotional agility means facing emotions by recognizing what we feel. This is a very important point. Emotional agility is something that we can learn, that we can improve. And the most important thing probably is to approach it with curiosity and not judgment, to learn from it. And when we face emotions, we create space for choice. And from choice, we create the possibility for change. And now let's bring practical tools with us, just to see what we can do. The first thing I would like to talk about is to pause. We saw that before, to listen to ourselves. And one of the first thing is to breathe. Breathing is something that we do, but normally we don't do in the correct way. In a stress situation, we don't breathe regularly. So I think that the most important thing is just to concentrate on breathing. Here, this is a technique. You can find many techniques on the web. This is a very easy technique that you can bring everywhere with you. It's about exhaling more longer than inhaling. So you inhale for 4 seconds, you hold the breathing for 7 seconds, and then you exhale for 8 seconds. This brings oxygen into the brain and makes you feeling more clarity and responding in a better way to events and to manage stressful situation. Breathing techniques can be also brought into the coaching space. We can breathe with our client together, and we can also breathe when this is one of the first thing we can tell our client when our client enters into the coaching space hyperventilating. And you can find many more techniques online. Another practical tool is about dealing with emotions. This is something that you can easily do by yourself. You can easily use with your team. You can use it with your patients if you are in a care relationship. And of course, as coaches, we can bring it into the coaching space. The first step is always to name the emotion. There is always a problem of vocabulary. We don't know a lot of emotions. We feel them, we have the basic emotions, we know the basic emotions, but normally the more deeper we go into the emotion, the better it is for us. So it is important to expand our emotional vocabulary. There are some emotions wheel on the web, but we need to be very specific to name the emotion. And gather any other information the emotion is bringing with us, because the emotion is bringing maybe shape or texture, maybe some sounds. We need to, of course, to make a big brief and to really to listening to ourselves and to see what are the information that the emotion is bringing. And also, where is the emotion situated in the body? Because maybe we can feel it in the heart or maybe somewhere else. This is important to know what is it about. And then we can stay with the emotions. The most important thing, the worst thing we do normally is that we want to get rid of the emotions. Because in the medical coaching, we say that there are not good and bad emotions, but that there are balanced and unbalanced emotions. But the thing is that we need to stay with the emotion, because when we are staying with the emotion, we can find a way to ask help, but also to identify what are our needs, what is the emotion telling us. So it's about staying with the emotion because it is okay, and then to ask ourselves, what is that I need? Do I need to ask for help? Do I need to do something different? What is this emotion telling me about the situation? And remember that you are not your emotion, but you have an emotion. And this is completely different because you can be angry in a moment. Maybe one day from the morning to the night, you can be angry with a situation for yourself, but you are not anger. And this has a completely different weight. So I was telling you, this is a practical tool you can use with yourself. You can use in a coaching session if you're a coach. You can use with others. You can talk about emotions. And we know very well the dialogue between a doctor and a patient is a dialogue that is also about emotions. So this is something that we can't eliminate. We need to name the emotions in that space. Another practical tool that I use a lot, I saw that it is very important. It's end of day reflection. Because what I saw in my experience is that healthcare workers often take work thoughts at home. So, of course, this is a work that never stops. But once they leave their work, they should be able to focus on something else at home, on their family, or maybe an hobby or whatever. But thoughts, a lot of thoughts are always coming up about situation, situation of the day, maybe a patient that is not responding well to a treatment, maybe miscommunication with somebody, something that happened to a colleague. So there are always a lot of thoughts. And what healthcare practitioners do many times is that they focus on what went wrong. So these thoughts are about what if I did this in another in another way, or that thing wasn't the correct one, or I could have done another thing. So it's always about what went wrong. Instead, and this increases, of course, mental and emotional load. It brings a lot of stress. So my suggestion is to shift the focus in recognizing small daily successes because medical doctor, healthcare practitioner do an amazing work, and I'm sure that that they can find a lot of successes in their daily life, in their daily work. So it's about really focusing, maybe writing down what went well. And this supports recovery and well-being. And in conclusion, I would like to talk about self-regulation in healthcare. Because self-care is ultimately an act of care for oneself, for patients, for colleagues. And it is all about self-regulation. Self-regulation supports your team, your colleagues, and activates your patient because self-regulation supports and facilitates the patient's journey of change. So the more you can focus and you can manage your stress, the more you find ways to respond to stress, to learn how to self-regulate, the more everybody will benefit from it. And there is also another perspective, co-regulation. Co-regulation is about using external support to regulate. It is mutual, dynamic, and it's a process of managing stress together. So, of course, by managing stress and self-regulating, you are co-regulating in the space. So you are making people feel better, more centered, because the energy you're bringing into the space is a calm a calmer energy. So co-regulation means that everybody will be better, will feel better, will work better. The team will probably have a better communication, and patients will also be able to improve their well-being. So this is very important, self-regulation and co-regulation in the healthcare field. Now, I would like to conclude saying that when you take care of your stress, you take care of those around you. And this is very important in the healthcare environment because we know that medical doctors, nurses, but all the healthcare professionals are the ones who less take care about themselves. So, I would like to invite you to make a picture to the QR code here. We have the Congress, the conference on the 24th of June in Neuchâtel. This is the agenda of the day. We have a lot of speakers that have already confirmed, so we would be very happy to have you with us. And thank you for listening. We will see you at the conference, hopefully, but there is also another webinar coming on May 21st. So please just stay tuned. Thank you and have a good evening or a good day, depending on when you are listening to me.